In this video, we will explore what is and what causes exhaustion syndrome. Now, first, what it is. Exhaustion syndrome is something that comes from prolonged stress without recovery. And at this state, the patient experiences a paralyzing fatigue that can't be recovered with just sleeping. Also, this patient can't perform everyday tasks. And this recovery takes more than 12 months, up to several years. The problem here is there is no effective cure yet for exhaustion syndrome. So we need to understand the causes and prevent it before it develops. We said that exhaustion syndrome is caused by stress. So where does stress come from? Stress comes from your environment. And the role that you take, this is you, in this environment will determine what situations you are placed in. Now, if you see the situation, if you perceive the situation as a challenge, then this will become a stressor, something that gives you a stress response, right? Stress response. And the stress response is really your body's way of, raising yourself to deal with a challenge. A typical stress response is the fight or flight. For example, you experience a threat and your body tells you to, start to mobilize your energy towards your brain and muscles to either fight or run away. And this is good, actually. This keeps you alive. So the initial stress response, the acute stress response, the initial acute stress response will increase your performance. Okay, and that was the stressor. Now, the problem here is if you allow this stress response to continue, right, to prolong, then this will start to damage your body and reduce your performance. This is what we call a chronic stress response. Okay. And in the chronic stress response, okay, you can see that stress lasts for a long time, typically, more than 6 months. And in the chronic stress response, the damages that you see in your body are several. For example, you experience body and headaches, irritable bowel, you have poor sleep, very tired and anxious, you have light and sound sensitivity, and you have poor memory, concentration, and performance. Now, to experience some of this, we can see that in patients who develop long-term stress responses, part of the brain, this is the brain, part of the brains called hippocampus is reduced. Another part of the brain called amygdala is increased. Now, hippocampus is a place where your body, processes orientation in space and daily events memory. So if this is reduced, then your ability to find, in space is reduced and your memory is reduced. Amygdala is a place where you process anger and anxiety. If you have increased amygdala activity, then you're more sensitive to become angry and more worrying, or you're more afraid. And patients who develop exhaustion syndrome, they ignore, right, these chronic stress symptoms, and they sacrifices their recovery time. Because if you discover a chronic stress symptom here and you take a break and recover, then you will not allow this the progression of exhaustion syndrome. But people who develop exhaustion syndrome, they ignore these signals and they allow the progression of exhaustion syndrome into a state what we call acute onset, where you suddenly experience a significant loss in your physical and mental condition. For example, you may be walking home one day and you take out the key, but you forget how to open the door, or you may be driving your way home, but you can't remember how to find, how to find your way home, although it's a regular route. So after this acute onset, patients start to pay attention that something is seriously wrong. They run into emergency typically, and the doctor will diagnose the exhaustion syndrome, and you're gone for more than a year.